شكرا. Good morning. Today we'll have another lecture regarding clinical skills and communications, which is the infection control. This is a very important lecture, especially when you are going to work in hospitals. That is why we put this lecture with the schedule of clinical skills and communications. The learning objectives of this lecture to describe healthcare associated diseases. You know, there are certain diseases which are associated with healthcare, with hospital work, right? The second thing, to study the frequency and the transmission mode of health-acquired infection or associated infection, and the common microbes from microbiological point of view. You have finished your microbiology courses. Now we are going to apply those knowledge with the hospital work. The third thing, to discuss the different measures of infection control and prevention. This is very important for every one of you to know how to control infection and how to prevent it. It's part of the duty of doctors everywhere. Now, there is a special entity that you have heard about it, especially in the news in the last 18 months, which is called PPE, personal protective equipment. And we are going to describe it to you today in relation to the health-associated infections. And to know the vaccines, which is very important, and we are all hearing what are the vaccines that should be provided, and especially we are living at the era of COVID-19. So we will see what other vaccines should be provided to the healthcare workers. The last thing that we are going to do is to show the different hospital signs and infection control. At the end of the lecture, I will present to you a video which shows you how the infection could be transmitted in the hospital. So let us start first of all with the healthcare associated infections. Before I start the lecture, there is a note, simple note, from last lecture. It came as a question. I talked about chiasmal breathing. The chiasmal breathing, when I was talking about it, I was talking about when it becomes deep. It starts, actually, I haven't put the details of it, hoping that we will tackle it in other lectures. Chiasmal breathing starts as rapid, shallow breathing. So everyone should know that the chiasmal breathing is rapid. But gradually, as ketoacidosis, for example, become worsened, it becomes deeper and start to become slower than the start of the chiasmal breathing. This is what I mean by slow. Slow, it means slower than when it starts. So everyone should know by now that the chiasmal breathing is a rapid, shallow breathing. Start like that, then become deeper and slower than the beginning, but still faster than normal. Still faster than normal. So I hope that this point will be passed to all students and not to be confused with the description. Healthcare associated infection can be divided into healthcare associated infection, HAI, and community acquired infections. Probably we have tackled these phrases with you before. Now, the health care associated infections, it means any infection that is acquired within 24 hours of admission to the hospital and 14 days after discharge from the hospital. Every infection acquired after 48 hours of admission to the hospital will be considered as nosocomial infection. Previously we said, but nowadays they say healthcare associated infection. And also 14 days after discharge. So anybody, these may come in a question sometimes, confusing, and they put different scenarios to you. So 48 hours, after 48 hours, and after 14 days of discharge. Community acquired infection, which is acquired during the ordinary life, the present, and during the incubation period in hospitalization. Sometimes the patient is admitted during the incubation period of a disease. This is not considered as hospital-acquired infection or health-associated infection. It is a disease which was during its incubation period. Iatrogenic infection. Iatrogenic, it means those infections which are acquired due to errors, due to medical intervention or surgical intervention. Example, when you put a catheter to a patient and the catheter becomes infected and then the patient becomes infected. This is induced by the healthcare workers, called iatrogenic, right? A surgical site, the incision where operation has been done. This has been induced by the surgery, so it's called iatrogenic infection, and they are type of health-associated infection. Sometimes they put to you questions and to see whether you know it or not. It is part of the health-associated infection, right? Mode of transmission, contact, could be direct contact, could be indirect contact. And I will explain to you the indirect contact. A person has been in contact with the patient, and then you became in contact with the person that has been in contact with the patient. Droplet, you know what we mean by a droplet, and we will explain more about it, an airborne infection. Patient most likely to get a health-acquired infection, of course, immunocompromised, long hospitalization. There is a policy that to keep the patient in hospitals as minimum as possible. If I tell you I should keep the patient 7 days and I can do it 5 days, I will choose the 5 days, right? The minimal period. يعني قديش نبقي المريض أقل بالمستشفى يكون أفضل. Why? Because of the risk of the health-associated infections. Very dangerous and very common in hospitals. And the microorganisms that are acquired from hospital infections or healthcare settings are quite resistant to many antibiotics and antimicrobial drugs. You can see in this picture that when here health care associated infection, increased number of drug-resistant pathogens, especially in hospitals. You know, these microorganisms have been adapted to the use of excessive antimicrobial agent, excessive antiseptics, disinfectants. So of course they become resistant. And failure of healthcare personnel to follow infection control. You can see the doctor is not achieving the standard health protection. And lastly, an increased number of immunocompromised patients. Nowadays, we are living at the era of cytotoxic drugs, corticosteroid therapy, immunosuppressive agent, immune deficiency diseases, different types of malignancies, all suppress the immunity. And those who has got suppressed immunity will be prone to get infections. So you have to be careful. The frequency of HAI, 5% of hospitalized patients. Patients become hospitalized. 5%, maybe more. This is in very well standardized hospital, 5%. It may be higher if the control and the prevention measures are not strict in hospitals. Could be more than 5%. The most predominant HAI is pneumonia. Patients come to the hospital to do an elective operation. Okay, he may get pneumonia from hospitalization, and so forth. Other many diseases, we will see them in the rest of the lecture. Now, bacteria in hospitals, as I said, are drug resistant. 70% of the microbes are drug resistant, and some of them are multi-drug resistant. And even there is a word, extended multi-drug resistant. Example of those microorganisms, Pseudomonas. انتوا عارفين Pseudomonas مشكلة المشاكل في المستشفى. Pseudomonas aeruginosa بالذات. Species aeruginosa. مشكلة المشاكل, very resistant. A patient with burr may get fully resistant infection with Pseudomonas aeruginosa. Multi-drug resistant TB is emerging as an entity, and especially in HIV infected patients. We said that immunocompromised patients may get these infections. VRE, vancomycin resistant enterococci, is a special entity. You know, vancomycin is one of the drugs that is spared for emergencies, spared for resistant microbes. So some microbes become MRSA, methicillin resistant Staph aureus, which is a problem. And when you are going to do some of the exam, you have to expect that they are going to ask you about MRSA. Last time I have seen a question, where do you detect it most commonly, the MRSA? In the nostrils, in the nose, okay? At the back of the hand here, because the person do like that sometimes, okay? So we'll get the microbes from the nose to the back of the thumb. And MERSI, methicillin-resistant staph epidermidis. Into the تشوفوا how important the microbiology in contact with the clinical work, right? And HIV, Candida, Protozoa, and other, and CRE, carbapenem, resistant enterococci, C, carbapenem, okay? So even the new drugs are becoming, the microbes are becoming resistant to them. You can see this, the common microorganisms encountered in hospitals, gram-positive, as I said, Staph aureus, and including MRSA, about 15%, which is high percent, and coagulase negative streptococci, including Staph epidermidis, coagulase negative. Okay, you know, staph are divided into coagulase positive, Staph aureus, and coagulase negative, like epidermidis, and others, of course. Enterococci, very important. Enterococci, vancomycin resistant, VRE. Gram-negative, E. coli, 10%, Pseudomonas, 8%, Klebsiella pneumoniae, and so forth. Enterobacter, Acinetobacter baumannii, very important. I have seen a patient a few years ago has done nephrectomy, removal of the kidney, and then he has got infection with these microbes and spread to the vertebrae. And the patient was paralyzed from that infection. So you can see that the health-associated infections are very important. Klebsiella oxytocca, as I said, carbapenem resistant Enterobacteriaceae. Enterobacteriaceae including enterococci. Okay, so Enterobacteriaceae may become all resistant. Enterobacteriaceae, it means the microbes that mainly live in the intestine, mainly in the colon. Enterobacteriaceae like E. coli, Klebsiella, and other enterococci. The first aim of infection control in hospitals to prevent nosocomial infection. Nosocomial infection, it means hospital-acquired infection. Okay? Although it has been replaced nowadays with the modern terms health-associated infection, healthcare-associated infection, but is still valid, nosocomial infection. How to prevent it? Education. Every one of you, all hospital staff, the community should know it. The best way to control such infections is hand washing. And I will come back to the hand washing. And you know, during the COVID-19, it became traditional that they are advertising that hand washing for 20 seconds is very important. Although from medical point of view, it should be more than this. It should be 30 to 40 seconds, right? But they don't want to make it difficult for people. They say minimum 20 seconds. We have to investigate the hospital for multi-drug resistant microbes, okay, and extended multi-drug resistant organism. And there is a section in the hospital called infection epidemiology section, a special section. This section provides doctor each week with the profile of the microorganisms predominant in the hospital and their susceptibility to the antimicrobial agents. بيزودون الأطباء بadvertisement that the microorganism encountered during this time such and such microbe and their susceptibility or resistant to antimicrobial agents. Implementation of policies of cleaning, disinfection, sterilization, and waste disposal. كثير من الأحيان you can see that a nurse has taken a sample of blood from a patient, and then to complete some paper, she put the needle on the table like that. Probably you have seen such a practice. Okay? A drop of the blood on the table may contain different microorganisms, including hepatitis B virus, which is very dangerous, right? So infection can be transmitted with such ways. Health worker protection. Health workers are very prone to get infected, and you have seen it during the tsunami of COVID-19, all right? Many doctors, many healthcare workers, unfortunately, died due to the transmission of the infection. So infection can be transmitted in a way that you are not going to expect it. Who knows that this table has been not infected? The doctor may come and put some office paper on the table and get the transmission of the disease, and so forth. The hands of the doors, everything. A stethoscope could be infected, contaminated, all right? Stethoscope. So it's a good practice to clean your stethoscope after each patient examination, right? Very good practice. هذا الجل اللي ممكن أن واحد يكون في جيبته أو معلقة على هذا الجل, okay, is very important to clean your hand, to clean your stethoscope, which is very important, or wash your hands. A prudent use of antibiotics. The bad prudent يعني الرشيدة. الاستخدام الرشيد للانتيبايوتكس. مؤتمرات كثيرة في العالم دائما تدعو إلى الاستخدام الرشيد للانتيبايوتكس. In many countries, especially the third world countries, okay, the developing countries, there are no policies strict policies to antibiotic use. A patient can go to any pharmacy and buy antibiotics, whatever the antibiotics is. This is not allowed in many developed countries. You have to have a prescription from doctors. And sometimes the patient takes a few tablets or capsules of the antibiotic and stop it. And يصير كويس خلاص يعني طبعا. This will create resistant microbes. And even there is nowadays a policy in hospitals which is called rotational use of antimicrobial. What is the rotational use of antimicrobial? I said the epidemiology section in the hospital will advise you that during this month, during October, for example, we are going to use such and such antibiotics. 4 gram positive, 4 gram negative, etc. Okay? So they restrict you to certain antibiotics, which are allowed to be used in the hospital. Next month, they are going to change to other antibiotics. Sometimes they do the rotation every 2 weeks, right? Even 1 week sometimes. So this rotational use of antimicrobial agents will decrease the possibility of developing resistant microbes. The precautions and isolation. You know, some patients are infectious, so you have to isolate them. Some patients are susceptible to infection. You have to isolate them, right? So what are the types of isolation we are going to use? I am going to discuss it. But starting again and again with the hand hygiene, washing and gloves. You know, in the beginning of the COVID-19, many people were wearing gloves, and this is very good practice, and it is traditional in medicine. And hand washing and gloves wearing, standard measures. These are standard measures to control, for example, rotaviruses, MRSA. Hand washing should be done before you contact the patient and after you contact the patient. You as a health worker, you may transmit infection to the patient. So in order to prevent this possibility, although it is remote, right, but you have to wash your hand before you catch the patient and after you catch, and even to use even with the use of gloves. Some gloves may contain cracks, ثقوب. You may get infection. يعني انت ما يصير واحد يقول والله انا كنت لابس قفازات gloves وخلاص يعني ما في داعي washing. No, this is not true. You have to wash your hands after you remove the gloves. The use of soap and water, or the Manoji, the gel that I have shown you, which is alcohol-based gel. And there are certain microorganisms that may be transmitted very quickly, including Clostridium difficile, for example. Sometimes we use gowns, يعني الروب اللي يلبسوه في المستشفيات. يعني انتم تشوفوا كثيرين من المستشفيات they take off their clothes and they wear the gowns and special clothes in the hospitals. Glasses, sometimes the infection may pass through the eyes. You have seen during COVID-19 that there is a shield to protect the eyes. And you may have heard the stories that wearing mask and gloves and other things not enough to protect, because the virus, the COVID-19 virus, may enter through the eye. That is why they use the shield or goggles, glasses. Now, in respiratory, these can be done in respiratory units, for example, which is commonly bacterial and viral, and the viruses could be transmitted from the patient to the health care workers. Hand washing. The father of the hand washing in 1865, just about 200 years ago, okay, by Sim Lewis. He had seen that hand washing has decreased hospitals' infections dramatically. You know, just 200 years ago, there were no antibiotics, no antimicrobial agents. Antiseptics were very limited, right? So he is the father who advertised the hand washing. So you have to do hand washing according to the theory before and after touching a patient. Logical, we know it. before and after touching patient surroundings, tables, utensils, other things, bed, before and after entering into the patient room or ward, قبل ما تخش على المريض وبعد ما تخش على المريض. So these are basic things. Every one of you should know it. This lecture is quite logical. I am sure many of the things that I have said you know it, but it has been organized in a lecture. فذكر اوكي فواحد من يذكر واحد تكون الفائده ان شاء الله راسخه. After cleaning, aseptic technique, you have always to use aseptic techniques, and especially you have to avoid exposure to patient's fluid, pleural effusion, ascitic fluid, sputum, urine, stool, etc. Doctors are in contact with the patient excreta or fluid and etc. Hand washing, as I said, 30 to 45 minutes. This is the classical medical, although it has been accepted for COVID-19 20 minutes. But classically, 30 to 45 minutes. If you have seen the preparation of surgeons, anybody of you have seen surgeons how they wash their hands before they go to operation? Anybody of you have seen surgeons? The surgeon, they wash their hands up to the elbow with a brush, right? And brushing their hands up to the elbow. And this can be done up to 5 minutes or more. Some advertise up to 10 minutes, okay, in order to clean their hands, and then they are going to wear the gloves for operation. So 30 to 45 seconds is not much. It's a quite short time. But to make it easy for the public, in order to make it easy for the public, they said for the COVID-19, 20 seconds will be enough. Nail cut. I advertise my daughters, Banati, when you are going to go to hospital, please cut your nails. Because microbes live under the nails in numerous numbers, and is a source of infection and a transmission of infection. Finger rings sometimes. If you are going to deal with patient and examine patient, I advise that you remove the ring, because microbes may live under the rings, and then after you finish, you can't wear it again. Okay? So it's a good practice like that. And you will be doctors for the rest of your life. Hand washing, you can see, I am sure that this picture is familiar to you. It passes into 6 stages, and the picture may explain it. Palm to palm, and then reverse it, and then bend it, and then the thumb inside the palm, and then you rub the tips of the fingers on the other palm. Right? This is very classical, basic things. Every one of you should master it. Right? This is the typical hand washing. مو واحد غسل يجي بس هيك على السريع، لا مو هاند واشنج. الهاند واشنج هو هذا. Safe waste disposal. يعني انتم شايفين يمكن في المستشفيات واحد ياخذ له عين الدم ويرمي النيدل هيك in the dustbin. This is malpractice. This can spread the infection in the hospitals. So you have, first of all, to remember how to dispose needles. They should be separated from other waste. Needles, العمال النظافة ممكن يتأذى فيها. Needles may be contaminated with very dangerous microbes, viruses or bacteria or others. So, in order to be safe for other people and safe for the hospital, to control infection, you have to know how to dispose the needles. Respiratory cases, we are talking about respiratory tract in my lecture, to use masks, disposable of secretions. واحد عنده سبيوتم من المريض مو يرميه هيك. Okay, there are special ways and special containers for disposal, and I will show you some of them. Education, you have to educate people how to sneeze, and you have seen that when you are sneezing you have to use your elbow, and you have to use the etiquette of coughing. You put something in front of your mouth, tissue for example, all right? And to avoid handshaking. And also during COVID-19 it has been advertised that you have not to shake hands. And again, hand washing. Isolation of precaution, as I said, how to isolate, I will explain in details how to isolate the patient. The question whether to isolate the patient in a single room, right? Or to put the patient with other patients. What will be the basic information that in order to take your decision you have to know? If the same organism, suppose you have a patient who has got Streptococcus pneumoniae and another patient with Streptococcus pneumoniae, there is no harm to put these two patients in one room. This is called cohort isolation. Cohort isolation. More than one patient in a room, right? Cohort isolation. Which can be used for viruses again. Respiratory syncytial virus, RSV, rotaviruses, extended multi-drug resistant bacteria, and so forth. There is a general rule how to use medical equipments and tools. Bronchoscopy, for example, a bronchoscope, endoscope, and so forth. And any material that you have to use, gowns, for example, towels, covers, syringes, etc. But try to use disposable one. After you finish, everything will be thrown away. Right? Equipments for pleural fluid aspiration, acetic fluid aspiration, disposable. They come in one unit. Use them and then dispose them. This is very important. Droplet precautions, there are two types of droplets. Those droplets which are more than 5 micrometer. Within 1 minute, they could reach 1 meter away from the patient. And that's it. They will not go beyond. They drop on the floor and that's it. The large particles from the patients, for example, in cough, some microbes, they produce droplets more than 5. So there is no need, if a patient has got such droplets, there is no need to shut the doors of the room of the patient. It can be open, right? And the reverse, if the droplets are quite minute, they may spread and taken by air to different areas. So we have to deal with it. How we deal with it, I will explain it in a moment. There are policies when to wear the masks. على أي microbes we have to wear the mask. COVID-19 first of all, okay? Neisseria meningitis, Bordetella pertussis. You know Bordetella, the microbe that causing whooping cough. Okay, Haemophilus influenzae, Mycoplasma pneumoniae, influenza viruses, adenoviruses, and SARS-CoV-2, right? And there are others, of course, but these are the main big items. How to isolate patients, and who are they? There is negative pressure room, and there is positive pressure room. الغرف المعزولة. Now, negative pressure room, NPR, for patients who develop droplets less than 5 micro, because they stay in the air floating and they can spread to distance, right? So, such as in tuberculosis, SARS, which is coronavirus, measles, varicella, which is chickenpox virus. These are contagious diseases, أمراض معدية تنتقل من مريض إلى مريض. The droplets which are produced by the patient will be smaller than 5 micron, which will be floating in the air وتمشي مسافات. So such patients should be put in negative pressure room. Air enters from outside in ordinary way, but when the air have to be evacuated outside, it should be sterilized. There will be filters in the room to take out the air, right? And these filters are called HEPA filter. And I will tell you what are the HEPA filter in a moment. And the air should be expelled outside, not allowed to re-enter again to the ward. يعني هذا الاير اللي يخش للغرفة لا يسمح له مرة ثانية بالدخول إلى ردهات المستشفى. It should be expelled outside. And these rooms are usually put in special areas. Okay? So the HEPA will filter the air and the microbes are trapped with the HEPA filter. These rooms has double doors and special locations, as I said. And I will show you a picture for it. Okay? Now, the positive pressure room or isolation. Now, here you have susceptible patient. واحد عاملين له immunocompromised، عاملين له bone marrow transplantation, for example. The air that should enter into the room, should be filtered. So the room inside will be clean of microbes. So this is a sealed single room. The pressure inside it is greater than outside. The air that enters into the room is filtered by HEPA filters. عكس النيجاتيف. النيجاتيف الاير اللي يخرج فلتر، بينما بالبوزيتيف الاير الذي يدخل إلى المريض should be filtered. This can be done for patients, for example, who are immunocompromised, like bone marrow transplantation. Bone marrow transplantation, we use immunosuppressive agents in order to prevent rejection. So the patient will be immunocompromised. IVF technology, special technology sometimes requires such isolation. HEPA, what is HEPA? HEPA is high efficiency particulate air filters. High efficiency, very efficient. Particulate air, they remove the particles from the air. So it's called HEPA. Arresting. This filter can arrest any particle that could enter to the patient or discharge from the room of the patient. HEPA filters. You can see the pictures on the left side, okay? Here for you on the right side, okay? A view of negative pressure isolation, chamber for the patient for contagious diseases. The negative for contagious diseases. For the positive discharge, for the positive pressure room, it is usually used for immunocompromised patient or IVF, some IVF. Protection precautions. For immunocompromised, for example, patients receiving chemotherapy, cytotoxic drugs, immunosuppressive agents, etc. You have to isolate them where? In positive pressure room. And also, not only this, hand washing, prohibit entry of infected person. Any person not allowed to go inside these rooms. Even the food staff is provided through certain ways to put hand through a special window, and then you deliver the food. The food is again very sterile, and everything that should be controlled this way. And some patients يجيهم زوار, visitors, جايب له ورد, جايب له إشي, جايب له أكل. This is not allowed. You know, some of these flowers contains fungi, العفنيات, الفطريات, some bacteria. So not allowed. Thank you for your flower. Is appreciated. They can put it outside the room. Okay? And the same thing for fruits and vegetables, unless they are washed very thoroughly. Washed very thoroughly before allowed to go to the patient. You can imagine, this is hand has been put on culture plate. Okay? This is culture plate. You know it from your microbiology. You can see the numbers of the microorganisms that have been seen after an incubation, isolated from the hand of an ordinary person. Okay? So that is why hand washing, not to shake hands, etc. And the other are the colonies of the microbes, especially fungi. Other points, in general, regarding hospital works, I said it miscellaneous points. Sometimes you get hidden, unrecognized infection, and has been seen again, I repeat it, with COVID-19. Many infected persons were not recognized, even they don't know themselves are infected, and they are among the community. This is very dangerous, that hidden or unrecognized infection. Example, MRSA, methicillin-resistant Staph aureus, are common among the community. 20% of the community harboring these microbes, 20%, maybe more even, in less hygienic community. فإذا عدد كبير من الناس، يعني هذا يروح يزور له مريض بالمستشفى immunocompromised، من يروح عليه على اعتبار هو محب، نعم محب، and kiss the patient, shake hands with the patient, and so forth, and the infection will be transmitted. We have to know that meningitis is very infectious disease. And you will have seminar, inshallah, سنة سادسة, about meningitis, and you will see how dangerous. Now, you have to know after using antimicrobial agent that the patient become non-infectious within 24 hours. Some doctors, some clinical staff, they think that the patient will be infectious for 2 weeks or 1 week. No. Patients infected with meningitis after the use of appropriate antimicrobial agent will become non-infectious within 24 hours. Cleaning a stethoscope, as I said, good practice. Washing white coats, كلكم أوصيكم. يعني at least your white coat should be washed once a week. When you go to hospital, you are going to carry with these white coats many microorganisms. You know, in UK, for example, now they are not using white coats anymore. يعني الأطباء يخشوا على المرضى بدون white coats. They have found that it's an agent or a tool of transmitting infection. حتى the ties, الأربطة, not allowed for doctors in UK. Okay? لأنه أيضا مرات أنت بدك تفحص المريض, your tie may touch the patient. Okay? So different countries, for example, in Ireland, they are allowed to use the ties, and doctors should go as a prestige in front of patient in good presentation, have to wear ties. So it's a good practice. If you are going to wear ties, you put your tie inside your shirt like that, which is a good practice, right? Even sometimes the sleeves of your shirt may be contaminated with the patient. That is why doctors, they take the shirt up above the elbow or around the elbow, right? This is good practice in hospitals. Vaccination. Health workers should be vaccinated. And it depends on the section, which section they are working. The common vaccine, I am not saying all vaccine, the common vaccine that should be used, hepatitis B, all of you should be vaccinated with hepatitis B before entering the hospitals. I advise you, all of you, is available in Jordan, right? And it's very cheap vaccine for you. And all of you should be vaccinated. And 3 doses, 0, 1 month, 6 months. 3 doses, right? Every one of you, before going to hospital, is very dangerous disease. And you may catch it from the hospital. And then you transmit it to your family. This is more dangerous. Usually hepatitis B infection characterizes by clustering. شو معناته clustering؟ واحد من ينصاب يصيب عائلته كمان أو أصدقائه. Right. Influenza virus. Right. This is anyone. Also, I advise you to take it. It's available. And probably soon it becomes available. Every year, right? Now, measles, mumps, rubella, MMR, you know it. Varicella, chickenpox, these are for children. And sometimes some adults who are in contact with children and has not been vaccinated or vaccinated since a long time during their childhood, it is advisable that such people should be vaccinated. Tetanus, diphtheria, pertussis, acellular pertussis, TDAP. Meningococcal vaccines, especially for microbiologists and for people who are working in the laboratory, because they are exposed to the Neisseria meningitis microorganism. These are different signs that you may find in the hospital, and you see them in the hospital. This is for infection control. And you can see the item. This is just to have an idea. It's not to, you can read them up to your knowledge. بس هي غير مطلوبة يعني. Now you can see PPE, gloves, etc. This is, now what is PPE? Personal Protective Equipment. Personal Protective Equipment يعني كل المعدات للوقاية. هذا معناته PPE. وتستخدم بكثرة، يعني استخدمت بكثرة خلال COVID-19. Gloves. Wash hands after use of the gloves, as I said. Isolation gown, الأرواب. Mask. Eye protection, goggles. Face shield, right? Respiratory protective, N95 respirator. وكلكم شايفين هذا الN هذا هو الماسك اللي عادة اللي هو هذا الاسمه N95. Okay? وفي different versions منه. Okay? Very protective. Very good. Okay? N95 respirator used to protect against TB, severe acute respiratory syndrome, SARS, and for COVID-19 again, smallpox, influenza, etc. Patient care equipment are controlled by PPE. Patient care equipment يعني مثلا respirator، جهاز تنفس. مو يجي واحد لا لابس جلوفز لا جاون لا كذا يجي يتعامل مع هذا الجهاز. لا, it should be used with a lot of precautions. وانتم شفتوا اللي يتعاملوا مع الكوفيد 19 كيف الملابس الفول بروتكتيف clothes. Environmental control, clean with standard measures. Linen, الأغطية should be all laundered, تكوى, autoclave and laundered. Okay? Disposal of sharps to special containers, especially when you are dealing with HIV, hepatitis B, and hepatitis C, and others. These are some of the containers for sharps. هذه الكونتينرز اللي ترمى فيها النيدلات مثلا. Very special. And the container is hard. يعني ما تنكسر ولا تثقب بسهولة. هذه بايوهازارد سيمبل. هاي كلها علامات تشوفوها بالمستشفيات، فيجب أن تكونوا على معرفة واطلاع فيها يعني. هذه another advertisement for visitors. The visitor should read it. Gloves important, hand hygiene, gowns, and special measures how to transport patient. يعني أنت من تاخذ مريض من الغرفة تبعته إلى الأشعة إلى الMRI، شو بتعمل؟ كلها measures هذه. Droplet precautions, airborne precautions. You can read them للاطلاع فقط يعني. أنتم مقبلين إن شاء الله خلال 3 سنوات will be doctors. By this, I have finished the lecture, and I will show you one of the videos. ممكن الأخ الفيديو اللي
نزلته ولا اللي عم تشوفه؟
نعم
اللي نزلته ولا اللي
تعال اليوتيوب. ايه هذا؟ ثواني بس لحظة. زين انا بدي اربط
في صوت من
هذا بدي اربطه. لحظة وكمان بس الإضاءة إذا. This is to show you the infection control, our spread of the infection. This is in hospitals. You have seen how anybody could put the light on, please. You can see that how the infection is spreading in insensible way sometimes. You cannot expect it, right? And there is, with the video, this video on the slide, there is another video very interesting, 24 minutes, summarizing all what I have said in the lecture. Very interesting. You can spare 20 minutes of your time, 25 minutes, and see it, which is very interesting. It's a lecture-like presentation. By this, we finish the infection control, and we'll give you a 10-minute break, okay? And then we come back again within 10 minutes, that is to say 10:22, okay? And start the video session about the clinical examination of respiratory tract. Very interesting. It's a clinical practice, and I am sure you will have a lot of benefit from this. This is very essential session. تفضل.